The following video is part of an educational series of meth prevention educational training videos. These videos were produced by MAP South Dakota, a project of Prairie View Prevention Services.
Methamphetamine is a highly addictive synthetic stimulant that affects a user's central nervous system. Meth can be inhaled, smoked, snorted, ingested orally, or injected. Meth can be found in several forms, including powder, crystal chunks, or pills. Meth users initially experience a pleasurable feeling from the drug with an increase in energy and alertness. They also experience decreased appetite, increased respiration, hyperthermia, and euphoria. Chronic use can lead to psychotic episodes and compulsive behaviors such as picking at their skin, insomnia, anxiety, and depression.
I've worked in the South Dakota correctional system since about 1987. At first I worked part-time in the correctional system and worked in private practice, but over the last several years I've worked full-time in the prison system. And one of my jobs is to oversee the dental department. I'm the chief dentist for the correctional healthcare system. And the other part of my job is to treat patients. I think 1999 was the year that I really started to see and suspect something was going on, but we started to see a very high incidence of severe caries and severe cavities and dental problems in our younger population. 18 to 25-year-olds were coming in with decay in every tooth in their mouth, and we saw some of that before with people that were using heavy pot, but it started increasing with such frequency that we knew something was up, and we started kind of looking into it, and we traced it back to the methamphetamine use that was seemed to be kind of on the rise in South Dakota. The last 3 years, it's really opened the floodgates of abuse with methamphetamines in South Dakota, and we're seeing it very much so in the prison system. I probably see 4 to 5 cases of meth mouth every week, and most of them are younger, 18 to 30-year-olds, and many of them have gotten to the point where we don't have a choice except to do multiple extractions, maybe full mouth extractions and dentures.
Standard of care states that the first step in any dental office visit should be a thorough medical dental history. Asking a patient directly about their medical conditions may provide more accurate information than just having them fill out the document in the waiting room. This also allows you to assess the physical, emotional, and mental condition of the patient. Investigate further if you notice any of the following. The patient seems confused, cannot focus, or is unable to answer questions. The patient seems nervous, paranoid, or talks incessantly. Patient has considerable dental decay or worn, broken, or cracked teeth. Patient is pregnant and still using meth. Remember, if the patient is taking a stimulant, using a local anesthetic with epinephrine could lead to a heart arrhythmia or other medical emergency. If you suspect a patient is using meth, you can use questions and statements like these to initiate discussion. How did your teeth get in this condition? Normally, we don't see this kind of decay very often. It's usually associated with someone who drinks excessive amounts of sugar drinks or someone who takes drugs. Have you used meth, or are you using it now?
This is my first time to see Amy, and as I look in here, I see that she has a lot of areas that have demineralized, which was probably a direct result of the meth use. She's had a lot of work done in the front of her mouth to straighten up the front teeth, but on the lowers she's got quite a bit of attrition, which is going to cost a lot of money to get all this work fixed.
Point out the first signs of damage. Express concern and try to educate your patient when discussing their dental findings. Explain how important it is to quit now.
I'm just going to have you open real wide. Amy's got a lot of decay around the gum line. And the conversation we had earlier is that every time one of these teeth break off, she can taste the meth.
Talk to them about taking better care of their mouth. Talk to them about lifestyle changes, staying away from the sugary pops, staying away from tobacco and alcohol. Prescribe fluoride gels for them to use at home to brush with to help prevent them from getting further cavities or further compounding their problem. And then, of course, we need to look at restoring their mouth and getting them back into good shape. A lot of individuals that are using methamphetamines are going to have some financial constrictions. They may not have the money and resources to pay for a lot of expensive crowns and implants and things like that. Sometimes it's doing just the basic things to get their disease under control. Extracting teeth that are not restorable, that are potential for infection. Putting restorations in the mouth that will get rid of the decay, the caries that is in their mouth, and get those type of things under control. So those cavities don't turn into more serious things that could lead to root canals or extractions or things like that. So do some basic restorative, and all dentists know how to do that well, and most of us can work with people that have financial problems and help them with payment plans, or doing the basics now and saving the more expensive things for later, maybe when they get insurance or get a job and can afford that.
Signs that someone may be using meth include the inability to sleep, nervous physical activity, tremors, decreased appetite, delusions, increased sensitivity to noise, excited speech, convulsions, or increased aggression. If you suspect someone is under the influence of meth or tweaking, you should keep your distance, avoid bright lights, slow your speech, slow your movements, keep your hands visible, and keep the tweaker talking.
If you suspect that somebody is using methamphetamines, number one, you have to be concerned for the safety of you and your staff. And so it's important to avoid a few things. First of all, jerky movements, bright lights, things that a methamphetamine user might misconstrue as a threat to them. You have to be careful, and so talk slowly. Don't shine the bright light in their face. The other thing is, if there is a threat to violence, it's important to contact the police and let them know that you have someone in your office that you suspect is using methamphetamines. We can't be too safe when it comes to something like that. And so if you alert the authorities, you can get some help so that if things do turn violent or become problematic, you've got some help. The other thing is, it just doesn't make sense to proceed with any type of dental procedure if a person is on methamphetamines. It's a drug that can affect the heart. It causes tachycardia and problems with the heart. And we wouldn't want to use any type of anesthetic with epinephrine or other medications that could trigger a cardiac event, a cardiac problem. And so we need to make sure and discontinue our dental procedure and let them know that it's for their safety. We don't want to do something that could harm them, and we need to be careful with that. So we want to watch out for things that they might be asking for. A person that's on methamphetamines may be a drug-seeking person, and so they may ask you for some narcotics or a prescription just to get me over, hold me over, so I, because I'm having so much pain. And mixing narcotic medications with methamphetamines, again, could cause problems, health problems for that person, and cause further addictions and further problems that way. So we need to watch out for that.
Meth causes more damage to the brain than alcohol, cocaine, or heroin. As a stimulant, meth can cause dry mouth by slowing saliva gland production. Meth users often use sodas, sport drinks, or fruit juices to quench their thirst. These high sugar content drinks and a lack of daily oral hygiene allow decay to happen quickly and extensively. Meth users who smoke or snort the drug display the most oral effects. Decay will likely be found along facial gum lines, root surfaces, and interproximals of the upper anterior teeth. The rampant caries spreads quickly around the tooth, causing such enamel destruction that extraction becomes the only choice. The patient may not experience the pain you'd expect from such extensive decay. This is because meth blocks or lessens the effects. Patients may report that their teeth decayed from the inside out, possibly because of the reduced blood supply to the tooth. The repeated shrinking of the vessels result in reduced nutrients to the tooth, which could cause it to die. More likely, the caries has undermined the enamel crown. Meth can cause the user to feel anxious or nervous, so they often clench or grind their teeth. You may see severe attrition and unnatural wear patterns. Users will often suck on hard candy or lollipops to keep from grinding or clenching their teeth. Meth smokers can exhibit lesions and/or burns on their lips, gingiva, oral mucosa, or hard palate. Those who snort may have burns in the back of their throat. Meth use decreases a person's ability to fight infection and heal properly after injury. Meth users do not seek regular dental treatment, so will often present with gingivitis or periodontitis from a lack of professional oral care and their inadequate home care.
One thing I would like to just talk about briefly is the issue of child abuse and methamphetamines. And it's staggering how many individuals that use methamphetamines have children in their households. People that are manufacturing methamphetamines, people that are using methamphetamines. And as a dentist, you may encounter a methamphetamine user who is a parent. And as dental professionals, we are required to report any instances of abuse or neglect. It's a state law. And if we suspect that, we are required to report that to law enforcement or the Department of Social Services. And in July of 2005, our state legislature added to that law, it was called House Bill 1258, that included children that are in households where methamphetamines are being used, distributed, or manufactured, are in a household that is could be described as an environment of child abuse. And so if you have a patient who is a parent and you know that they're using methamphetamines or you suspect that, you should be reporting that to your local authorities, because by definition of our law, that is abuse, child abuse. And there's a huge amount of child abuse going on in methamphetamine households. If you think about it, a parent that is high for a few days and then crashes, they're not going to be a very good parent. And the child is going to be left oftentimes to fend for themselves, get themselves to school, get themselves fed, grooming. All those things that parents need to help them with are going to be neglected. And children are coming out of methamphetamine houses that have been severely abused and neglected.
Reports should be made immediately to the state's attorney of the county in which the child resides, to the Department of Social Services, or to law enforcement officers. The report should contain the name, address, date, and place of birth of the child, the name and address of the child's parents or guardians, the date of the report, and evidence of suspected or proven child abuse or neglect. For more information on reporting abuse or neglect, visit mapsouthdakota.org for a link to the South Dakota Department of Social Services.
As a health professional, if we report an incidence of suspected child abuse, we are immune from liability. And so as long as we report in good faith, somebody cannot come back and sue us and say, you know, they reported us for child abuse and we weren't doing it, and so we're going to sue them for libel. We're protected from that, and so we don't have to be concerned about that. What we do have to be concerned about is the children. You could really do your community a favor by getting some children out of an abusive environment. It's important what we do in the dental office, taking care of teeth, but saving a child from a life of abuse is something that we'll always look back on as something that we're very proud that we have done.
The manufacture and use of methamphetamine impacts every corner of your life. It is a problem that is increasing in South Dakota and will only grow unless we take steps to stop it. The MAP South Dakota project was launched to provide awareness, education, and resources to South Dakota communities. The video you have just watched is one of a series of meth prevention training videos produced by MAP South Dakota, a project of Prairie View Prevention Services. These videos are made possible by a U.S. Department of Justice grant. To learn more about how you can become involved in this effort, visit mapsouthdakota.org or call 800-343-9272.